Well, I don't know the details because I was a kid at the time, but something happened that when my permanent teeth came in, um, the enamel on the outside was soft, and so it was pocked and had surfaces and edges that a lot of kids didn't have. And as a result, I've always had problems with trapped bacteria in food that either demanded the kind of attentive maintenance of brushing and flossing that we never show at age 14 or 15. And a lot of cavities as a result of it. They kept me in a dental chair. So I have a natural aversion to having somebody working in my mouth that close to me from childhood just because of this anomaly. So I've required a lot of dental care over my life, and I'm very particular about where I seek it and my expectations as a result of it, because it's been something that has never been something I've been really comfortable with, but have needed. Well, it's kind of stupid, so I'm embarrassed, but the word sedation led me to believe that they would make sure that I wasn't apprehensive about whatever I had to get done. And I moved from Carper, where I had a good dentist that was just too far away to justify, to Raleigh. And sedation seemed like a good idea to call, and I made an appointment to initially and get my records transferred here, and it worked out with ease. Well, I'm a hospital administrator by trade, and I don't bring that up because I don't want people to think that I think I know something about healthcare delivery that would be extensive or professional. But I look first of all for professional competence. Do they really know their profession? The second thing I look for is patient-focused care. Is it basically directed toward me, or is it what they do for everybody that comes in? And the last thing is customer service and courtesy. And I found all three of those things here, and can almost give you anecdotal examples of things that gave me that comfort. In the professional competence department, I had to have an extraction, and Dr. Tracy, who I believe is a portion of the sedation concept of this practice, because A, she's an attractive person, B, she's an attractive woman, and C, men try to act really brave around attractive women. So we act like we need less sedation than we might actually do so. So I think she served that role, said she didn't do extractions, and she would have to turn me over to Dr. Dan for that. And I was a little uncomfortable at first, but then I realized it was because one of them was really good at something that the other one didn't do as well, and they made the decision to do so. After the extraction, I lost what I thought was a sense of taste, and this goes beyond the scope of just, filling cavities. And the next time I came in, Dr. Dan sat down and talked to me about the literature he had researched and colleagues he had talked to about the phenomena of the loss of taste sensation as a result of a tooth extraction. And it was so thorough and well done that he stopped between other appointments, came into the room where I was having my cleaning done, and laid out what he'd found about it. The second thing I talked about was kind of patient-focused, individualized care. I don't know how many people come to their dentist and say, I can't taste anything on this side anymore because of the extraction you did, can you help me? But that was my specific problem. I can't imagine this guy deals with something like that on a day-to-day basis. But the fact that he researched my problem as an individual patient and came back to me with results without being asked speaks volumes. And the last thing is the customer service and courtesy. This practice has agreed to do something that I'm not sure many people get, which is a wake-up call, like you get at an expensive hotel to make sure I make my appointments. I'm sorry, but as time has gone on, I've needed that more and more. Well, I have two messages. One would be to potential patients and one would be to other practices. In this practice, everybody who works here has a picture on the wall, and you can see them. And that means that they're happy to identify with the organization. I can't tell you how many places I go for healthcare where the name tag is flipped around backwards so you won't see their picture or their name. Like I said, I worked in hospitals, so that means that the fact they know your name when you walk in here, the fact that they're all happy to be associated with one another and they publicize it, kind of sets a tone of comfort when you come into the place. I know not many people might have those reasons for it, but I think almost all patients sense it. The next thing is they won't do something outside the scope of their professional competence. As I explained about Dr. Tracy turning me over to Dr. Dan for the extraction, and even having me go to someone else about having a implant. I think Dr. Dan knew what I was going to run into and said something to me that was innocuous at the time, but became almost prophetically true, which was that you might want to see how long you can go in this state after the extraction without the implant, and whether you're going to be okay with that or not. Because some people actually get over the extraction, are able to continue their bite and everything else in a normal fashion. It might not be true of you. I'm not trying to tell you what to do. And sure enough, when I went to see the guy who did implants, it was like buying a new car. First of all, it's not cheap. Secondly, there's like rebuilding a bone. And thirdly, there's not these guarantees. When I came back and talked to Dr. Dan, he said, I didn't want to upset you with the details because what you want is what I want my patients to get. But I thought if you went to see this guy, who was someone he referred me to, who he had a working relationship with, he would help you find your answers and you would make your own decision. And I sit here now telling you that I will do just fine with that specific implant. So, if somebody walks in here, they'll begin with that sense of comfort that everybody knows each other and they don't mind being identified with each other, and they're always professional in their presentation. And that I've not really needed much sedation because of the comfort I felt psychologically and otherwise with the practice itself. I feel very fortunate because I walked to a place after having moved for the first time, which I came to because it said it would sedate me if I couldn't handle what was going on. I've needed very little of that name in any of the treatment I've received. And I think I stumbled on, through good fortune, some very accomplished, professional, competent dentist and a staff and an office and a service that has I've become completely wedded to. And so I would promote it, not just based on the fact that I've been here, but that I'm a healthcare professional and I've been through delivery of service circumstances, and what they have here is something really special, worth pursuing and considering.